Hi, I'm Kitty Lamprecht and I'm your physiotherapist. This is just before your back operation, and you're going to have a discectomy. So maybe we can start by looking at how the back moves, or how movement in the back takes place. Movement takes place over two columns. You have the front column or the anterior column, and there is a disc in between the vertebrae. So the disc is a spacer, and it functions as a shock absorber, but it's also a nutritional method for the cartilage of the vertebrae, and that's quite important. The disc in itself looks like a balloon with jelly in it. So it is got a outer rim of ligament, and then it's got a soft center. And because it's got a soft center, it has pressure, like you have blood pressure. And it does more or less what blood pressure does. So if we push up our blood pressure, we have a stroke. And more or less the same thing has happened to your disc. The different positions and what push up the pressure. When we do your home program, I will give you a graph to explain that to you. But certain things that we do, for instance, sitting, push up the pressure in the disc, and that is how it has torn. So the facet joints, and then at the back, the posterior column, we have small facet joints. Now it's a very small joint, and it's like the joints in your hands. But like any other joint, it's got cartilage, and then it's got a little capsule around with the fluid inside. The fluid is quite important because as we move, the fluid will help the cartilage to glide, but also will feed the cartilage. So if we do not move, then the cartilage in the facet joint can get damaged. So what is going to happen is that your disc has torn, and some of that jelly has then run out and then sits next to the nerve in the canal. So what Dr. Lamprecht is going to do is just make a small window in the bone, get into the canal, and then just clear the canal out for you. That's quite important. So because of the nutritional properties of the disc, we don't want to take the disc out, because if we do, then the space will be too narrow for the nerve in any way, and you will need a fusion. That is why we do fusions. So we're just going to clear out the canal, and we want, where the ligament has torn, we want the body to form scar tissue for us, so that you can keep the rest of the gel inside, and therefore protect the rest of the back. Which means that until that has happened, and that scar tissue takes about 6 weeks to form, it is quite important to keep the pressure as low as possible, and that hence our program. So, and one of the things is then that you are not allowed to sit, which is very important for the future of your back. So when you wake up, you are going to lie on your back. The reason for that is it gives compression on the wound, and it limits the bruising, and therefore speeds up the healing. You will have a catheter in, so you don't have to go to the bathroom. You will most probably have a drain that comes out of the wound, and you will have a drip on. The drip will be for medication and pain medication. So, and I want you to lie on your back for at least 4 hours after the after 4 hours, you are allowed to turn, and it is a good idea to turn because it decreases our stiffness in the body and makes it easier to stand up. But in that 4 hours, you can move your legs, and the next video that we're sending is a demonstration of how you can move in the bed with ease, and how you should move your legs. Then after 4 hours, it's a good idea to ask the nursing staff to help you to turn. And if you want to sleep on your side, then they can help you just before bedtime to turn, and then for you to sleep on your side. What is also important is that you need to remember that in the ward there are so many different operations, and the nursing staff can't always keep track on what every person and what is every person's precautions. So it is quite important that you remember, and that you remember that you cannot sit up. So when you want to eat, it is best to either lie on your side, or they can tilt the whole bed up so that you're more straight up and not sitting up. And I think when they want to do that, you need to remember and remind them that you had a backup and that you're not allowed to sit up. The other thing is that when you wake up, there should be something around your calves that pumps up and relaxes. So you're going to feel something that gives pressure and then releases. It's quite nice. But that helps with your circulation and prevents any clots forming, especially because we're not moving so much. It is quite important, if you don't feel that, please ask the nursing staff to check and to make sure that they are working, and that you have that around your calves. Then the next day, I will come and we will get up, and then from then on we are going to start to stand and eat and move around, and it will progress very quickly from there. The rest of the program I'm going to explain to you as we go along, because that's very individual. But I think for the moment, just remember, turning after 4 hours, move your legs, remember about the calf pumps, and then, not to sit up. I'm looking forward to see you.